Hello, thank you for the opportunity to speak here today. My name is Allison Jenkins. I'm a registered nurse in the state of Massachusetts, as well as a student at the Regis College Family Nurse Practitioner Program. I'm a former pharmaceutical sales representative and a nurse at a community hospital. I'm here today representing the Massachusetts Department of Elder Affairs in support to testify for the adoption of H2377, an act to permit the wholesale importation of prescription drugs into the Commonwealth. The cost of prescription drugs in the United States is out of control and becoming unaffordable to many lower and middle class residents of Massachusetts who at times need to decide whether to pay for groceries or their prescription medications. This bill would create a state-administered wholesale importation program where the state is the licensed wholesaler importing drugs from a licensed regulated Canadian supplier solely for the distribution to voluntarily participating state-licensed in-state pharmacies and administering providers for the exclusive purpose of dispensing state residents with a valid prescription. This bill would provide significant drug cost savings to the Commonwealth's consumers and only import those prescription drugs expected to generate a substantial savings to the Commonwealth's consumers. This bill would require participating health plans to demonstrate to the department how savings on imported drugs are reflected in the premiums and limit the profits and the profit margin of any participating wholesaler and or distributor of imported pharmaceutical products to a specified amount established by the department. Additionally, this act will create a publicly available source for listing the prices of imported prescription medications that shall be made available to the participating entities and consumers. The U.S. pays by far the highest price in the world for prescription medications. Given the fact that most industrialized countries have a universal single-payer healthcare system, they have greater negotiating power with pharmaceutical companies to price their drugs at a lower cost. This is not the case in the United States. Our prescription medications are unaffordable to many, and the price increases of many prescription medications are greater than the rate of inflation. According to the most recent Centers for Medicare and Medicaid Services projection of national health care expenditures covering 2019 to 2028 project that total drug spending will grow from 13.7 to 13.9% of national health care expenditures, which will equate to $500 billion in 2018 to $863 billion in 2028. Pharmaceutical companies are continuously increasing the number of U.S. patents on their medications to hold exclusivity to their drugs, in which they continuously increase the price of year after year. Take, for example, the drug Humira. This drug is used to treat arthritis, psoriasis, and Crohn's disease. The drug came to market in 2003 and now holds a total of 257 Humira-related patents on their drug, with the last set to expire in 2037, preventing cheaper biosimilars from entering the market. With this strategy, the makers of Humira have had a 470% price increase since they've come to market. The makers of Humira have collected $16.1 billion in U.S. revenue from Humira in just 2020, costing Americans $72,000 per year for this drug, which has no alternative option for the treatment. As a former pharmaceutical sales representative, I can attest to the frivolous spending that occurs in the pharmaceutical industry within the United States to bribe or coax prescribers into writing prescriptions for their promoted products, even if it wasn't the best or cheapest option for their patients. The wine and dine mentality of that industry was full of wasteful spending and certainly contributes to the greater cost of prescription medications in the United States compared to the rest of the world. Research shows that Canadian drug prices are typically from 28 to 35% cheaper than drugs in the U.S. Pharmaceutical companies do not waste money trying to wine and dine individual prescribers in Canada because a national healthcare system, there's no courting with the pharmaceutical companies, and the country has great weight in their negotiating powers to approve drugs for the entire country to use. We can benefit from this. By voting to approve H2377, we can help reduce the cost of necessary and life-changing prescription medications to our Massachusetts citizens. This is our chance to ease the burden of healthcare expenditures to residents of Massachusetts and perhaps allow some of them to not only choose whether to pay their electric bill or pay for medically necessary prescription medications. Thank you for your time and consideration today and listening to my testimony supporting the passing of this act. If you have any questions, please feel free to contact me. Thank you for your time.